Good morning, everybody, and let me thank all of you for joining us today. And I'd like to welcome you here to talk about an important issue for our community, and that is addressing gun violence. I have the pleasure of being joined today by several area organizations and community partners. But before I do that, let me recognize my colleagues on City Council and the City Administration that are here. You'll be hearing, well, Vice Mayor Trish Whiteboard, that's behind me. Councilwoman Stephanie Moon Reynolds, Councilwoman Anita James Price, and you're going to hear from Councilman Joe Cobb shortly. And our city manager, Mr. Bob Cowell, is here, right behind me. And let me just say that I'm delighted and honored to be joined here today, which will include the Carilion family, the clinic. Carilion Clinic will be here, Family Services of Roanoke Valley, and Total Action for Progress. And thanks to the combined efforts, and I say combined efforts of everyone represented, the City of Roanoke's Gun Violence Prevention Commission, which Councilman Cobb will speak to that shortly. But I'm delighted to say that we are the recipient of $550,000 of state and federal funding, which is coming to our city to address the impacts of gun violence on those communities most at risk. And that's so important. And the funding will go towards boots on the ground. And I'm sure Councilman Cobb will talk to you a little bit more about that and how we perceive that will work. And all the programs that you'll hear about them shortly, as they will come and tell you how their program is going to operate and use these funds. And this funding is so meaningful to our community as we continue to address gun violence and the many issues that stem from gun violence. During today's press conference, we will hear from Dan Freeman with Carilion, Linda Henschel with Family Service, and Annette Lewis with TAP about how their organization will be utilizing these grants over the next 2 years to work towards creating long-term solutions for our gun violence issues. But first, I want to take this opportunity to bring our councilman who works hard, has been doing a lot of work, as you know, with our Gun Violence Prevention Commission. And so please join me in welcoming Councilman Joe Cobb to speak more about these grants and their impact on our city. Councilman Cobb. All right, y'all, we give a hand. We can do that.
Thank you, Mayor Lee. It's an honor to be here. I do want to introduce a couple of people that are citizens who are serving on the Gun Violence Prevention Commission behind me, Rabbi Kathy Cohen and Dr. Eric Anderson. And I'll also want to introduce the coordinator of our Youth and Gang Violence Prevention team, Mr. Chris Roberts. Every incident of gun violence in our community tears at the heart of who we are. Each death, each injury due to gun violence represents a person, a part of our community. We all feel the pain, the brokenness, the heartache, and the deep, unimaginable grief. But none perhaps as profoundly as the families who are left reeling in shock, having to say goodbye to a loved one due to senseless violence. Over these last 3 years, our city has been working tirelessly through the efforts of citizens, community partners, the Gun Violence Prevention Commission, and local government to create meaningful and sustainable efforts addressing prevention, intervention, and response to gun violence. One of the initial recommendations of the task force to reduce gun violence, then chaired by Shakira Williams, was the creation and implementation of a coordinated rapid response, engaging our local hospital and community partners in a wraparound effort to provide support for individuals and families who are directly affected by gun violence. Today, through collaborative efforts of the Commission's grants team and 3 community partners, we are pleased to announce the receipt of 3 new grants, federal and state funded, that will aid our community in providing hospital-based intervention with outreach into the community, mental health counseling in an area of our city most affected, and emergency relocation and safe housing for families at risk of exposure to further violence. Because we have worked hard to create a community-based infrastructure of support and collaboration, these grants reflect our desire as a community to work together and to bring about change for the benefit of our families and our community. With these grants, the fabric of our community's response to gun violence grows stronger. In a few months, when a gunshot wound victim comes to Carilion, they and their family may be connected to the counseling available at the Envision Center at Lansdowne, or safe housing available through TAP, and any number of incredible community resources we have available. These connections can mean the difference between someone getting caught in the culture of gun violence or breaking out of it. I'm optimistic about our community because every day I see community members and partners making a difference through positive, encouraging, and opportunity-based relationships that we are creating and sustaining together. Through these short-term and long-term efforts, I'm confident, and we are confident, that we will break this cycle of violence and reduce gun violence in our community. At this time, it's my honor to introduce Carilion's Director of Trauma Services, Dan Freeman.
Good morning, and thank you for having me here. I'm with Dr. Brian Collier. He's behind me. He is our Section Chief of Acute Care Surgery, as well as our Trauma Medical Director. He joins us today in this announcement. On behalf of Carilion and Dr. Collier, I'd like to thank you for having me here to speak today on this important community health topic. I'd also like to extend a thank you to the Virginia Department of Criminal Justice and VHHA Foundation and everyone else that helped make this grant and funding possible for Carilion. In 2023, Roanoke Memorial Hospital will celebrate our 40th anniversary of being a designated Level 1 trauma center. During those 40 years, we have seen our fair share of gun violent injuries. In 2019 to 2021, in fact, we've seen a 48% increase in the total number of gun-related injuries. I'm confident that this grant and the funds made available will further help us as a community address the disparity at the root of gun violence. To accomplish this, we are launching the Violent Injury Recovery and Support Program. With a structure similar to Carilion's successful Bridge to Treatment program, which helps substance use disorder patients find treatments and other resources in the community, we will develop a team of intervention specialists. During a patient's hospitalization, our intervention specialist will connect with our patients daily and evaluate the patient's needs. They will act as care coordinators and connect them with the community resources and some of the partners that we have here today once they are discharged. The assessment or evaluation of the patients within the hospital will cover a variety of patient needs, from mental health, substance abuse disorders, and housing. And this will contribute to the patient's overall well-being. Our intervention specialists will stay in contact with their patients beyond discharge from the hospital. In fact, they will stay in connection with these patients for up to a year after discharge. We are excited to extend the care we offer to these patients beyond the physical injuries, beyond our trauma bays and the hospital walls. Focusing on a patient's overall wellness is one of the most important things we can do to help better the health of the communities that we serve. Thank you again for your time. Our next presenter is Linda Heschel, President and CEO of Family Services of the Roanoke Valley.
Thank you, Dan. Family Service of the Roanoke Valley is so excited to be present and partners with the city as we celebrate these grants. I would like to first give thanks to Virginia Juvenile Justice and Delinquency Prevention for making this happen and for helping the children, teens, and families in our community. Our grant is to supply counseling at the Envision Center that will make counseling readily available to the residents of Northwest Roanoke. Our specific goal is to have a counselor present 5 days a week at the Envision Center adjacent to Lansdowne Park. Residents will be able to make appointments for counseling as well as take advantage of drop-in counseling when stressors of life and challenges are too much for them to endure on their own. Northwest Roanoke has significantly been impacted by gun violence. In 2021, 40% of gun violence victims were from this location of the city. Family Service wants to support the families, the victims, the neighbors, the friends of those who are still traumatized and anxious over the violence that this gun violence has created. My hope is that Family Service will also be able to help decrease the stigma often associated with mental health. People need help when life's crises and chaoses become more than they can handle alone. Family Service wants to be there to help be that support for individuals and families. I'm here today supported by representatives from Carilion and TAP. We are so grateful for these grants because we know that we can make a real impact within this community. Thank you so much, and I will turn the microphone over to Annette Lewis, President and CEO of TAP.
Good morning. I think all of this is very, very exciting news for our city, and we're so grateful to have this opportunity to share in what we believe will definitely make an impact in our city in addressing gun violence. Thank you, Linda, for the introduction and the comments that were made on behalf of TAP. I'd also like to thank Virginia Department of Criminal Justice for providing us with this important grant for the Gun Violence Emergency Relocation Project. This will help relocate low-income families in Roanoke away from hotspots of violence and unsafe living conditions. We have used the successful model with victims of domestic violence and hope that this effort will help keep children out of harm's way. It fills a gap in some of our local offerings, not only helping those directly impacted by gun violence, but secondarily, victims as well. It will help give victims a fresh start and proactively address multi-generational trauma. This project incorporates a housing-first approach to increase the safety of families at the highest risk of gun violence. It also assists with strong supportive services to address trauma and provide families with resources to improve mental well-being and assist them to sustain safe housing. The goal is to serve 12 families over the grant period. At TAP, we believe community action is about getting people involved in their own lives and enabling them to help themselves. This grant will directly help families advocate for themselves and their needs and lead to a better community. All of us will be happy to answer any questions after this news conference. But before that, please let me introduce our last speaker. We're fortunate to be joined by Munch Dungy. As a community member who has been directly impacted by gun violence and a mentor with the city's Reset program, he will speak to what these grants mean for our community members.
Good morning. My name is William Dungy. I would like to thank you all for allowing me to be here today. I count it as an honor and a privilege. Excuse me. I'm here today to talk about Reset and the Reset program. Thank you. I'm here to talk about Reset and the Reset program. Reset is an organization geared towards helping families that have been affected by gun violence. Reset also engages with the people in the community to hear their concerns in hopes of preventing further occurrences. I fell victim to this about 7 months ago. I lost my son, Will Jr. It was one of the hardest things that I ever had to face in my life. No parent should ever have to bury their child. And although I couldn't save my child, I'm trying to build a village so that other parents don't have to go through the hurt and pain. This is why I became a mentor for the Reset program. The program works with the youth to address behavioral concerns, to promote healthy communication, teaching them to make better decisions and to be proactive and not reactive. Our youth require help. Help with academics, resume building, job placement, social skills, and most of all, how to conduct themselves. With this program, they're given tools to empower them. This program has allowed me to express my grief, to give back. If I can save just one, then my job is done. I thank y'all and thank you for your time.
Everybody's going to be here to answer some questions if you want to do it in a group or individually. But that concludes the press conference. Thank you.